Hi, I'm Tori Johnson with the Society Diaries TV, and I am here today with Dr. Stephanie Perez at UT Health San Antonio. Stephanie, thank you so much for having me today.
Thank you for asking me.
Yes, well, Stephanie is actually not a medical doctor, am I right? You're actually a scientist.
Correct.
I think that is absolutely incredibly unique. Now, Stephanie, I'm reading your bio here, and you actually have a bachelor's and a master's degree in biology from UTSA. And you hold a PhD in neurosciences from the University of Texas Health Science Center, now known as UT Health San Antonio. Wow, I am just amazed. Now, have you always wanted to be a scientist from when you were a little girl?
I did not always want to be a scientist. I didn't know that that was actually a career option, but I was always interested in the sciences. It wasn't until I got into college that I took a class and found out that that was actually a real thing.
Right.
Not just somebody making things explode. It's actual career that people, do science.
Wow, now I'm sure that you've had many challenges to get where you are today. Tell us a little bit about those obstacles that you went through.
So personally, the biggest obstacle, I had a child at a young age.
Okay.
So my biggest obstacle was raising my son while going to school and having to support a family and take care of him. But I felt it was always important to have an education, and I really wanted to instill that in my son, that no matter what, if you want something bad enough, you're going to make it happen and you're going to do it. And I felt that way about school, so here I am today.
Wow, well, those are some really important foundations to teach our children. So not only are you an amazing mother, an amazing scientist who's giving back to our community each and every day right here in San Antonio. Now, why don't we talk a little bit about your research? It's my understanding that you're currently on a research team studying schizophrenia and other mental health disorders. Tell us a little bit about that research and what are the implications for society today?
So our lab primarily, like you said, focuses on schizophrenia, and this is a very important disease because it's a lot more common than people think it is.
Okay.
And the therapies that are currently available are not always effective, and they do cause severe side effects. So the goal of our research is to find better therapies for the treatment of this disorder, with the ultimate goal being to find the root cause of the disease so that we could find a cure.
Okay. Now, tell me a little bit about, Stephanie, what really drew you into personally wanting to study about mental health disorders?
I honestly didn't know very much about mental health disorders when I started my PhD. It was more of the techniques that were done here at UT Health San Antonio that I was interested in. But in learning how to do those different techniques and learning more about the diseases, I just became really passionate about that and about the people that live their everyday lives with these symptoms and disorders.
Right. Well, I can certainly see your passion, and I know that mental health disorders is a topic that's really getting a lot of public awareness right now. Speaking of the public, how do you go about getting this research out into the public?
So recently, as part of the Mayor's Fitness Council, we sponsored an event we call it a mental health panel, and it was the first event that the city put on, which was very exciting for myself to be part of this. And the main goal of these events is to break the stigma associated with mental disorders.
Okay.
And just to show people every day, in our everyday lives, we have problems. Everybody has a portion of their life where they're down, they may be depressed. That's a mental illness. There's something physically wrong with you that's causing you to be depressed.
Okay.
Now, when that depression takes over our life and can't move on, that's when we need to seek treatment, and we don't want people to feel ashamed that they have to seek treatment. So speaking out to the public, just raising awareness on these different disorders and where to go and who to seek treatment with, and to break the stigma so that they're not embarrassed to seek that treatment, is really what we want to address to the public.
Yes, this is certainly very commendable and a very worthy topic, I think, especially right now with what's going on in society. Now, it's my understanding that I believe the Neuroscientist Center also even has a patent pending. Can you talk a little bit more about that?
Yes, so as part of our research, the main goal obviously is to develop a therapy that we can then take to the public to help ease these symptoms and hopefully help, treat their illnesses. One of the things that helps that is to get a patent on the work, and that allows us to get those therapies out to the public.
That makes complete sense. Thank you for shedding a little bit of light into that. Now, it's my understanding that you receive grants as well as private funding to be able to do the research that you do today. So tell me, how is that funding vital to what you do, as well as how is it used?
So the monies that we receive from private funding as well as grant money allow us to actually perform our research. That goes to everyday operations, that goes to collaborations with other investigators here at UT Health San Antonio. That also goes towards us filing for patents, as we mentioned earlier, that allow us to then give our treatments back to society. They also allows us to share our research with other scientists, not only in San Antonio, but also in our country and around the world. Wow. And that's important so that we can advance our knowledge together. So we share what we do with other scientists, and that lets us know what's going on so that we can then take the next step and ultimately find cures.
So that funding is truly vital in getting that research, finding cures, and really helping society, not just today, but truly impacting our future generations.
Exactly, yes.
UT Health San Antonio is the premier catalyst of the $37 billion bioscience and healthcare sector of San Antonio. If you'd like to support researchers like Stephanie and help make a difference for a healthier tomorrow, visit the link at the bottom of the screen and donate to research at UT Health San Antonio.